ADHD symptoms, causes, and treatments. ADHD symptoms. ADHD is one of the most common childhood disorders. Attention deficit hyperactivity disorder. ADHD is characterized by a persistent pattern of inattention or hyperactivity impulsivity that disrupts functioning or development. It is a neurodevelopmental disorder or a brain condition. Symptoms in children. ADHD symptoms can manifest as early as ages 3 to 6. Inattentive symptoms. Failure to pay attention to details, or making careless mistakes in school. Struggling to maintain focus during play or tasks. Age-inappropriate brief attention span. Not listening when spoken to directly. Failure to follow through with instructions. Experience difficulty in organizing schoolwork. Missing details or overlooking details. Avoiding tasks that require mental effort like schoolwork. Frequently losing items like school supplies. Frequently shifting from one task to another without finishing. Hyperactivity symptoms. Constantly in motion, without a clear purpose other than movement. Restlessness, fidgeting, or squirming in their seats. Have difficulty playing quietly. Talking excessively. Impulsivity symptoms. Blurting out answers before questions are finished. Have difficulty waiting their turn. Engaging in risky behavior without prior thought. Get upset easily. Many of these behaviors are typical during childhood development and must exceed what is normal for a person's age and development stage for ADHD to be diagnosed. Many children with ADHD may experience mild delays in language, motor skills, or social development. Approximately 20 to 60% of children with ADHD experience learning disabilities that affect reading and academic difficulties such as poor grades. Approximately 60% throw temper tantrums. Older children exhibit low tolerance for frustration. These difficulties can contribute to issues with depression, self-esteem, anxiety, or defiance toward authority. What causes ADHD? ADHD appears to have multiple causes including genetics, brain abnormalities, and environmental factors. Genetics. Research shows ADHD is highly hereditary and influenced by genes critical for brain development and functioning of brain chemicals. Most people with ADHD have many gene variations, each with small effect. These variations, combined with environmental risk factors, contribute to an individual's overall risk of developing ADHD. In rare cases, ADHD is caused by unique gene mutations or chromosomal abnormalities. Brain abnormalities. Non-inherited neurological factors that influence brain development have been linked to the development of ADHD. Children with the condition have lower levels of the brain chemical dopamine, which plays a crucial role in various essential functions, including cognition, motivation, movement control, and behavior. Research shows these parts of the brain is responsible for attention, social judgment, and movement also have lower metabolism. Differences have been observed in the development and activity of the prefrontal cortex, basal ganglia, anterior cingulate, cortex, and cerebellum. Brain injury from lack of oxygen, epilepsy, and traumatic brain injuries can also increase the risk of developing ADHD. Environmental factors. Maternal smoking and drinking alcohol, or cocaine use during pregnancy. Premature birth, or low birth weight, less than 3 pounds. Brain injury. Poor parental mental health. A 2024 meta-analysis found that maternal stress, anxiety, and depression had all been positively linked to ADHD in children. High conflict home environment, or early childhood trauma. Exposure to toxins, such as pesticides. Nutrient deficiencies, such as zinc, magnesium, and vitamin D. How is ADHD diagnosed? ADHD is diagnosed based on clinical evaluation by a behaviorist. There are no lab tests or imaging results that can confirm it. Working as a behaviorist, I evaluated and recommended treatments for children with ADHD. Parents and teachers are usually involved in the evaluation process. Some conditions such as mood disorders, sleep problems, and oppositional defiant disorders share similar symptoms as ADHD. It's important for a doctor to rule out these conditions. The DSM-5 diagnostic criteria for ADHD include 9 symptoms of inattention and 9 symptoms of hyperactivity and impulsivity. A child must exhibit at least 6 symptoms from one or both groups to qualify for a diagnosis. Treatments for ADHD. Although ADHD cannot be cured, it can be effectively managed by several types of treatment. In preschoolers, it is recommended that parents be provided with training in behavioral management before considering medication. Behavioral management. Behavioral treatment should begin as soon as a child is diagnosed. Early intervention before bad habits develop is beneficial. Many techniques can be used, such as counseling, cognitive behavioral therapy, classroom behavior management, incentives and token rewards, parent-child interaction therapy, social skills training. Key points for behavior management include setting achievable goals in small steps, while maintaining consistency across times, settings, and individuals. Applying consequences immediately after behavior, and using behavioral interventions consistently over the long term. Medication. ADHD medications can be used alone or in combination, which is based on the individual's symptoms and needs. The most commonly used medicines include psychostimulants, selective norepinephrine reuptake inhibitors, SSRIs. When stimulants don't work well or cause too many side effects, doctors sometimes use other types of medications, such as alpha-2 agonists. However, these alternatives are generally less effective and are not usually the first choice for treatment. It's my hope that this information is helpful. If you have questions or comments, please let me know. Please subscribe. Thank you.